My name is Joshua Austin, and I'm a dentist here in San Antonio, Texas. And treating kids can be a real challenge. And some days it's really great, and some days it's a little bit tougher. Always is challenging when you have somebody experiencing something new in a dental office. It can be scary. There's scary looking pieces of equipment, there's scary sounds. Sometimes there's strange smells here from the different things that we use. And that's all new to kids. And I think we oftentimes take for granted the fact that well, for most of us, this is regular and we come here twice a year and we know all about what's going to happen. For a kid, that doesn't always happen. So we want to try to make things as comfortable as possible for the kids in the practice. And most of the time, it goes really well. And every once in a while, we have some challenges, but we always have ways to work around it. In our practice, we make sure that we treat kids who are a little bit anxious about visiting our practice with respect. And the one thing that I never want to do is to create a bad traumatic memory for a kid in our practice. So we never push kids to do things they don't want to do. We never push kids to do things they don't want to do. We always make sure that we tell kids what we're going to do next, what the steps are, and what to expect. I never want a kid to feel like I tricked them into giving them a shot, or I distracted them one way and then gave them a shot or poked them with something in another direction. We want to make sure that they never feel like they were a subject of misdirection, so to speak, which was really common when I was a kid. The other thing that was really common when I was a kid was just holding a kid down to do what you needed to do. Trauma be damned. And that's not what we do here. So we try to keep things very positive. We do a lot of what's called happy visits here to make sure the kids have good experiences, especially their first experiences here in a dental practice, to make sure that they don't carry on those types of traumas into their adulthood, creating dental phobias for the rest of their life. The most important thing about getting maybe a slightly anxious child ready for their dental appointment is don't introduce thoughts into their mind that may scare them. You have no idea how often we see a parent come in and say something like, I told you this was going to hurt, or they're going to stab your gums, or they're going to shoot x-rays into your head, or any of those types of things that just makes everything worse. So you just want to tell your kids that it's going to be an easy visit. We're going to take a look at their teeth, we're going to count their teeth, and we're going to make sure that their teeth are healthy just like the rest of their body. And that's it. A lot of the dental phobia and anxiety that we see in kids are phobias and anxieties that were introduced to them by their older siblings, their parents, people in their family. It's almost like generational trauma. We read a lot about that in other types of psychotherapy and mental health. But the same thing can happen in a dental office is that kids can carry on trauma that maybe their parents had just because some of the things that got said in and around the house, some of the things that got said to the kid about what to expect at their appointment beforehand. And it introduces all this noise into a kid's mind that they have a hard time silencing because they don't have any experience to know that those things aren't true. So we want to try to keep that to a minimum. Just tell your kids it's going to be a great experience. It's going to be very, very easy, and that we will take great care of them because you know what? That's all true. When treating kids in a dental practice, distraction is king. If we can distract them for even a few minutes, it makes it so much easier for us to get our x-rays, do their cleaning, check their teeth, all those kind of things. So in the ceiling above our dental chairs are TVs. And on those TVs, when kids come in, it's things like Bluey and SpongeBob and all those types of things that kids like, Coco Melon and all those different things. And so it's a great distraction technique for our kiddo patients in order to let us do what we want to do. And honestly, they don't remember getting the x-rays. They don't remember having us polish their teeth or having any of the plaque cleaned off of their teeth. What they remember is that they got to lay in the dental chair and watch television, Netflix or Hulu or whatever it is, and then that they got a cool toothbrush at the end and a little prize as well. So we like to introduce great memories for kids when they think about coming to the dentist, and that's one of the ways that we do it. When working with kids, we find the tell, show, do method to be the best in order to make sure that kids are on board with what we're going to do. We tell them what we're going to do, we show them what we're going to do, and then we do it. We never want to surprise them. We never want to try to trick them. We never want them to say, hey, look over here, and then we come at it with a needle from the other side. We don't want any of that. So we're always upfront. We're always honest with kids about what's going to happen during their appointment to let them know that, hey, there's nothing to worry about here. I find that to be a much better thing to do is to treat kids with respect. I wouldn't want that done to me if I were at another medical clinician's office. And so I don't want to do that to anybody's kids. So we always make sure that we tell, show, do first so the kid understands. And when kids understand, it just makes the visit so much easier and less anxious for everybody involved. Positive reinforcement is king with today's kids. When I was a kid, I just remember the hygienist that cleaned my teeth as a kid hounding me about how I wasn't flossing right or brushing enough. And it always seemed to be negative. And we don't want to create that type of stigma for kids' memories about their dental visits. We want to make sure that we are reinforcing positively and then making sure that we then add on to what improvements can be made from there. For some kids, honestly, it can be hard to find some positives in their oral hygiene routine because they don't have one. But we always try our best and then try to introduce things slowly to them so it's not just being barraged by a bunch of different things that they need to do at home. So positive reinforcement is king. And then we go on to small things that they can improve from there, trying to make sure that we're getting better at things like brushing and flossing and developing those healthy habits early on. That is really important in creating oral care for the rest of their life. For kids with, let's say, moderate to heavy anxiety, a lot of times nitrous oxide or laughing gas can be used to make them more comfortable during their visit. It's a very safe drug that's been used for hundreds of years, especially on and with great effect on kids, that helps mellow them out a little bit and make them much more comfortable during their appointment. Most kids don't need it, but kids that are really anxious, it can really benefit them. So we use it quite frequently, especially when we have to do some restorative procedures, some things like fillings and things like that. If that makes a kid really anxious, let's do a little bit of nitrous during the appointment, and that will make it an easier experience for everybody involved. If you want to schedule a happy visit for your kiddo in our practice, give us a call. That's the best way to reach our practice. You can also request an appointment online at our website. You can even send us a message on Instagram if that's easier for you. We'd be happy to get your child set up with their dental home for life.